what this threading is compared to Botox.
That's a great question because the threading is very exciting. It's called PDO Threads, polydioxanone, which is the suture material that we use. It's completely different than Botox. Now remember, Botox is a paralytic agent. In other words, when we inject Botox, we're stopping muscle pull in a certain area, crow's feet, forehead, that kind of thing, to help minimize wrinkles. Now what the threads do, as you age, things start to droop a little bit, skin sags a little bit. So the threads we can use to reposition the skin to some degree and also fill out wrinkles. So the threads, they generate collagen.
Oh, they generate. It's
Yeah.
not just kind of like tightening and pulling.
It
like
does
face
both.
lifting.
They do both.
Okay.
We can tighten and pull with the threads. We can also put them in like deeper wrinkles, like on your neck or your nasolabial folds, or those kind of areas that will then generate collagen and thicken and reduce their depth, like almost like what a filler would do.
Right.
So the threads are completely different than Botox, and many times we use them together.
Oh, okay. And so what is the length of time that a thread takes to kind of show any improvement, and how long does that last?
Well, when you walk out of the office, you'll see the improvement. So the improvement's almost immediate in terms of seeing the tissue shift and fill. They incorporate over the course of about 6 months and last 2 to 3 years.
2 to 3 years. Great. And so on a financial standpoint, that's a pretty good, recovery on your money, right? For what you get?
Well, it depends on what you're trying to achieve. In other words, most people will look to do the same thing with fillers. And remember that fillers are usually a hyaluronic acid-based type of filler that probably is going to last about 6 to 9 months. So even though the threads may start out sounding a little bit more expensive, you got to remember that over the course of 2 to 3 years, you're going to have maybe three or four filler sessions.
Right.
So you can compare those two very easily and make your mind up in terms of which is a better value. But again, it really comes down to what you're trying to accomplish. If you need a facelift, you need a facelift, and we can,
right.
We can improve it with the PDO threads, but we're not going to mimic a facelift. But we're definitely doing a ton of stuff. And when you start putting all of these treatments together, we'll have patients come in and they'll get the PDO threads, they'll get some Botox, maybe a little bit of filler, and then finish it off with maybe microneedling, Morpheus 8, microneedling to the face to help the texture. And when you start stacking those treatments together like that, you really get a beautiful result, and you can take years off your appearance.
Wow, thank you. I appreciate all your info.
Well, you had a great question. Thank you.
Yeah, thank you
You're welcome.
Thank you for the call.